Good evening. I'm Stephen Bleeker, CEO and founder of Assurance Home Care. Along with my business partner, Christine McGinn, we're delighted to welcome you to this evening's panel as part of Briere Month. Here at Assurance, we feel so honored and proud to be part of this cause that's so near and dear to our hearts. It's really what we do every day, helping individuals to do more than just remain in their home, but to really thrive on their terms with highly customized one-on-one care plans. At Assurance Home Care, we know that investment in research at Briere drives the evolution of patient care, both at Briere and across Canada. Every day, researchers at the Briere Research Institute continue to find new ways to maximize quality of life and help people stay and return home. As our population ages, these investments will only become more important. We are proud to partner with Briere this September and encourage you to support this important cause by visiting bemovedtogive.ca. Thank you.
So good evening, everyone. My name is Ruth Slack, and I'd like to welcome you to the Briere Research Panel discussion on World Alzheimer's Days. And the topic we're talking about is transforming care for those living with dementia. And today we're going to talk about some of the important and groundbreaking research that's being done at the Elizabeth Briere Research Institute related to memory, dementia risk, and dementia care. And I think we can all agree that there's an urgent need to move this field forward as quickly as possible. The number of people living with dementia is rising rapidly. And I think everyone watching has some lived experience, either a family member, a neighbor, or a friend living with dementia. So we desperately need to find effective treatments quickly. The University of Ottawa Brain and Mind Research Institute is very proud to work in partnership with the Briere Research Institute to really enable us to maximize the impact of our discoveries. So through collaborations, by bringing together experts from different fields of research, including clinicians that work in the hospitals, neurophysiologists, those are the people that look at the brain circuitry to understand how memories are made and stored and what goes wrong in the context of dementia, who work together with psychologists, engineers, and epidemiologists to really address this critical research question. So it's becoming very clear now that to truly accelerate this research field, we need to collaborate and work together. And researchers have to get together to share ideas, critique each other's data, research approaches, and come up with a transformational research program. And today we're going to talk about one of those, about transforming care for those living with dementia. So now let's begin our panel discussion by introducing our panelists. So the first panelist is Dr. Amy Shu. Dr. Shu is an investigator at the Briere Research Institute. She's an assistant professor at the University of Ottawa. She holds a University of Ottawa Brain and Mind Research Chair in Primary Care in Dementia. She uses population-level health data and specializes in long-term care, healthcare needs for individuals living with dementia. And she also uses artificial intelligence mediated risk prediction modeling. And I think she'll be talking about that today. So welcome, Dr. Shu.
Thank you for the introduction, Ruth, and good evening, everyone.
Our second panelist is Dr. Frank Noffel, who is a physician at the Briere Memory Program. He's a senior investigator at the Briere Research Institute and a professor in the Department of Family Medicine at the University of Ottawa. He's also an adjunct professor in systems and computer science engineering at Carleton University. He's the co-founder of Age Well, which is a national innovation hub for sensors and analytics for monitoring mobility and memory. And his research is on the use of technology to facilitate aging in place. So welcome, Dr. Noffel.
Thank you for the kind introduction, and hello, everyone.
So this is a panel discussion, so feel free to send in your questions. And I'll begin with the first question to Dr. Shu. So Dr. Shu, you with your collaborators have created a dementia risk calculator. Can you tell us how this research contributes to dementia prevention?
Well, thanks for the question, Ruth. I think, as you mentioned in your introduction, the number of dementia cases worldwide and in Canada as well is rising quickly. So from data that we've seen published by Statistics Canada and also the Public Health Agency, we know that over the past 10 years, the proportion of dementia cases has increased by about 20% in the Canadian population. And what that means is that of individuals over the age of 85, 1 in 4 in Canada will likely experience dementia or be diagnosed with dementia. And so the idea behind the calculator that we have developed is actually led by Dr. Stacy Fisher. She had completed this as part of her dissertation at the university. It's called the Dementia Population Risk Tool, or DEMPOR. It's a freely accessible web calculator that was developed to really highlight the existing evidence that we have and know about dementia risk prevention. So in fact, when you look at prior research, what we learned is that approximately 40% of dementia cases are considered preventable. And by focusing on some of these modifiable risk factors like your diet, your level of physical activity, your mental health and well-being, level of stress, these could all reduce your risk of developing memory problems, cognitive decline, and dementia in the future. So we wanted to use this population database to help Canadians understand what contributes to their risk of developing dementia in the future and what they can do to prevent or reduce that risk. And the calculator is available on our research team's website. It's called projectbiglife.ca. And the dementia calculator takes about 3 to 5 minutes to complete, and it's designed for older adults over the age of 55. So I highly encourage everyone to take a look and learn about what are some of the risk factors that contribute to the risk of cognition issues and memory problems and dementia in the future.
Thanks, Dr. Shu. So just to follow up on that question, in your studies, what are you finding is the greatest risk for dementia?
Yeah, I mean, physical activity is definitely high on the list. For a majority of our users, you'll see that physical activity is one of their biggest risk factor. And it's a challenge, especially during COVID. Over the past year and a half, many of us have been working from home. And so we're starting to, I think, lose some of our, for many people, some of the social engagement and the activities that they participate in to keep them active, or even thinking about walking. And of course, in Canada, our Canadian winters are long, right? So we have to think about creative ways to keep ourselves active. And in the research that we've done, and also in the extant literature, we know that the recommendation is around 20 to 30 minutes of aerobic activity every day. And so many of us use activity monitors, physical trackers to make sure that we stay on top of that and meet those goals. But physical activity is a big one that we've identified in our research.
Thanks, Dr. Shu. Dr. Noffel, did you want to comment on that? Do you have any follow-up comments on that?
Just to clarify, obviously it's we're not getting enough exercise, and it's the lack of exercise that increases our risk of cognitive impairment. I think that was obvious from the question. And other than to say that it is that one of the things that the first things that I prescribe in my clinic for anyone concerned about cognition, that's the first thing I say is physical exercise. And it's part of the three-legged stool: physical exercise, cognitive activities, and social engagement. Those are sort of the three easiest things that people can modify.
And I'm sure the pandemic had a huge impact on that, didn't it?
Absolutely, on all of those, because one of the first things that closed was gyms and swimming pools. So a lot of older adults will go to the swimming pool in their building. And if that closes, of course, that's a huge factor, especially if you're in an apartment building. It's harder to get exercise. Then there's the fear of contacting people. So, people are decreasing their social interactions altogether. So if you're afraid to to take the elevator to go downstairs to go for your walk because there might be 3 other people in the elevator. That's understandable. But of course, it's cutting off your connection to the outside exercise you would otherwise get. So unfortunately, I agree with Amy that there's been a very significant impact of the pandemic on cognitive health.
Great, thanks. So maybe now we'll change gears. I have another question here, and this is for Dr. Noffel. How does your research support an advanced dementia diagnosis?
Sorry, do you mean early diagnosis of dementia?
Yeah.
Or yes, okay. So yeah, so my research, as you mentioned earlier, is really about using technology to facilitate aging in place, and part of that is early diagnosis of cognitive change. So we consider a sensor any technological tool that collects information, and that information then can be used to help with early diagnosis of cognitive change. So as a for instance, playing a game on a telephone or on a tablet, you are creating data. You are generating data by the time with which you respond to the question, or how you answer the question, or how you move puzzle pieces. So one way to take information is to take games and look at people's gaming and use that information to help with diagnosis. So if people are forgetting the rules, then that could be with regard to memory. If they're slow at responding, that could be speed of processing. So you can see how you can integrate into games measures of neuropsychological measures that we would otherwise have to do with a paper and pencil test, which of course generates a lot of stress. No one likes to come and pass tests, whereas playing a game is a lot less challenging for people and a lot more fun. So there's one that people don't often think of, but it's sort of the using data that we're already generating to help diagnose. So there's a group, for instance, looking at typing. And so we type a lot on our phones and on our computers, on our keyboards. And again, that is information that can be used to see if our spelling, for instance, ability is changing over time, or the speed with which we type, or the type of words we use. So again, you can use that kind of information. So this is indirect information that's not that painful to collect. So that would be part of what you could do for early diagnosis. Now, the other completely opposite side of the spectrum is, of course, to use more invasive technology. But one of the things we've been looking at in our lab in partnership with others has been early changes in EEG signals. So as you can imagine, wearing an EEG cap with multiple electrodes, you can generate information by performing a cognitive activity. And we can use those electrical signals with complex algorithms designed, of course, by my engineering partners to extract information out of these changes in waves, in EEG waves. So again, you can take how the brain is acting and responding, extract electrical information from that, and then try and convert it into a diagnostic information. So two extremes. One is our regular day-to-day activities where you can extract information out of, and then another is, a more wearable device where you come to the lab, you perform activities, and then you extract information that way.
So what about aging in place or staying at home? Can you track movements and activities in the home?
Absolutely. So we actually consider, activities of daily living one of the most important markers to track in the evolution of cognitive decline, because initially we have little memory problems, but they don't impact our day-to-day activities, and that would be mild cognitive impairment. Subsequently, we start having difficulty doing some of our day-to-day activities. That's when we transition to early dementia. And then, of course, over time, unfortunately, as the disease progresses, we increasingly lose our independence and activities of daily living. So there are sensors that can be placed strategically in the home to look at that kind of activity of daily living. Right now, we have a trial going on in people's homes where we're putting sensors in the kitchen, for instance. And over time, we're going to see, does their use of the fridge or certain cupboards where certain ingredients might be, does that change over time? Are we still washing vegetables? Are we still doing all those kinds of things? Or are we simply taking something out of the fridge and microwaving it, which of course is a lower level of functioning than creating food from scratch. So we are working on monitoring activities of daily living in a way to monitor a cognitive change over time. But we're also looking at systems that can provide cueing. So it's not just we're watching things deteriorate, but we're also providing a system for cueing to help people maintain that activity as well.
All right, thank you. So the next question is for Dr. Amy Shu. So I have a family member that has dementia, a mother who developed dementia at a young age. What would be my risk? Would I be at elevated risk compared to someone else? And is that preventable?
That's a great question. And if it's okay, Ruth, I'd like to come back to that. I want to actually build on one of Frank's earlier points, which is one of the things that we've seen with our population level data research is that the management of your chronic diseases. So many of you might be, of our audience member might be familiar with the association between looking at your cardiovascular risk factors and your risk for stroke, which is also a risk factor for dementia. And one thing that we've seen in our research is that a person with hypertension and their adherence to their medication regimen, it actually sort of parallels, it reflects the changes in cognition. I'm sure, Frank, you've seen this in your clinic where their medication adherence might start to decline. And that's actually one of the first signs. I think often people think about dementia as just memory loss, and that's just one component of it. You know, it's an umbrella term looking at the syndrome, looking at how it impacts your function, and including things like medication, your ability to perform just small activities, you know, paying your bills on time, grocery shopping, preparing meals for yourself. And Frank, I know with your sensor work, you're also tracking medication use. I believe this is something that you were interested in looking at in your research as well.
Absolutely. So the one of the, like you said, one of the first changes in instrumental activities of daily living is doing the finances, which is you know, a complicated thing that we do, paying taxes and all those things that we have to manage. But the medication compliance is early on, and so we have been looking at different types of well, I'll say sensorized boxes where we have been looking at, you know, can we establish a pattern of medication compliance? And then, you know, again, it's not just monitoring and noticing errors, which of course is important for a clinician, but then how can we cue the person to remind them to take their medication? So if I haven't opened my pill box, when I'm supposed to take 8 o'clock pills, if by 8:30 I haven't opened that pill box, there's a little sensor that hasn't been triggered. You know, can we send a reminder to the patient to take their pills? And we can repeat that reminder until finally the pill box is opened and they take their pills. These are still experimental products, but they definitely have a potential.
Yeah, and coming back, I guess, to the earlier question, Ruth, I think a lot of us, especially today, we're talking about World Alzheimer's Day. A lot of us are aware of the genetic linkage and the genetic underlying genetics as a risk factor for Alzheimer's disease and dementia. But I think the reason why I also brought up that example with medication adherence is that a large proportion of the things that we do can modify our risk. So we think about everything in our environment, everything that we do that either puts you at an elevated risk, so you're basically exposing right, your genetic predisposition to greater risk of experiencing the health outcome, or you can try to moderate and mitigate and minimize some of these risks. So even thinking about how you manage your other risk factors. So earlier we talked about physical inactivity as a risk factor for dementia. But if you're physically more active, it also reduces your risk for heart disease. It reduces your risk for diabetes. It reduces your risk for stroke, which is all tied to dementia. And there are also connections to mental well-being as well, right? So greater exercise improves overall mental well-being and health. So there are tons of things that we can do. And when we look at research, so the Lancet Commission had published this large report summarizing risk factors associated with dementia. They first released a report back in 2017, and last year they just released an update. When they released a report back in 2017, the estimate was around 30% of the dementia cases were associated with, were attributed to modifiable risk factors. Now, the most recent report, they now put that number at around 40%, because now we have a better understanding of these risk factors, better understanding of what are the behaviors that people can engage in to reduce their risk. And I suspect that in 3 to 5 years' time, when they release another update to the report, we'll have an even greater understanding of what contributes to our dementia risk. So we're starting to learn that by modifying things like your diet, what you eat, how often you exercise, monitoring your own mental well-being and stress level, all these things could reduce your, even if you have the genetics, right? You have the genetic risk for dementia or any other disease, all these things can be moderated by the activities that we engage in. And I think kind of coming back to Frank's earlier point about the role of technology, this is something that I think technology has both potentially a role for helping us to think about prevention, but also monitoring care. So one slide I often show in my presentation is I would pull up my own data from my Fitbit. And so you could see, you can actually draw out periods just from that implicit and that, monitoring of your heart rate and your sleep pattern and your activity level. You could actually pinpoint periods when you know that it was a stressful time. So I often pulled up the data for the week before a grand deadline. So you can see the heart rate, baseline heart rate going up, activity going down, sleep also, the hours of sleep also decline. And these are the things that maybe we're not, actively aware of or thinking about. But a lot of this technology could actually help us to think about how we improve our health. And that's actually where I know Frank's research is going, and where I'm hoping to take my research to take these existing technology that everyone is using and sort of repurpose them. We're thinking about different ways of using and applying that data to help us to improve our health and reduce our risk for chronic diseases.
Right. And your dementia risk calculator, what is the uptake of that? Are there a lot of users, and can people follow their risk over time, like go back in a month or go back in 6 months to follow that?
Yeah, so since the release of the calculator earlier this summer, we've had 700,000 users from around the world on our website. And most of that was actually within the first 2 weeks. And overall, the response has been positive. I think a lot of people, it helps them, prompts them to think about, what am I doing right? What do I have to correct, right? To live a healthier lifestyle, to reduce my dementia risk. And so we're trying to, the current calculator on the website doesn't actually collect any personal data. So we're not storing any personal information, but we're trying to work with partners who are interested in using that information to help people monitor their health. So potentially, one of our industry or technology partners could implement the algorithm in an existing health tracking app that they have to then use that information to inform people's healthcare and health decision-making. So that we can actually link the different pieces of information. And, we're not really, like our current calculator doesn't have that built-in prompt to remind people to exercise, but I could easily see that partnership with industry partners who are interested in, helping people improve their health and using our calculator to inform that.
Yeah, there's a lot of potential for that. You can put it on your phone and that kind of thing.
Exactly.
All right.
Can I just jump in here?
Yeah.
I think, Amy, you did mention a lot of things that we could do more of, but I think one of the things we also need to remember is there's things we can do less of as well to, decrease our chances of getting dementia. So for instance, smoking, we know that clogs up the arteries. And if you clog up the arteries in your brain, then of course there's going to be less oxygen going there, and that can affect your cognitive function. Similarly, alcohol. We know that significant alcohol consumption on a long-term basis can affect the brain's health significantly as well. So again, it's something I think we could include in a personal little daily check-in. How many cigarettes did you smoke today? And we can build in some kind of harm reduction as well. And finally, something that is supposed to be inherently good, which is medication. We take it for good reason, and there's lots of good choices out there. Unfortunately, there are some that can affect cognition quite substantially as well. So one of the things we always need to do is to check with our physicians to make sure that there's no side effects of the prescribed medication, but also natural products that we might take or antihistamines that we might take over the counter that can have a negative effect on cognition.
Yeah. I was going to mention antihistamines. They're very common, or Gravol, Benadryl. How does that affect? How does that affect the brain? And their risk for dementia.
Yeah. So the way I would look at it is that if you take one antihistamine a day, and it's then that is going to help decrease your allergies, and that's a good thing. But if you use it for sleep, for instance, that can become a challenge. And if you have a brain that's already suffering a bit, then taking medication that can add drowsiness to it, that can clearly that'll slow down thinking further and impact ability to perform. So yes, you want to take medication. So but then if you have a cognitive issue or you're worried about your cognition, certainly I would always make sure I would check with my family physician or my treating physician to make sure that it's the lowest potential impact on my brain.
All right, thanks. So maybe we'll go back to talking about the technology and these devices. How does this new technology that you're working on improve the lives of people living with dementia? Does it help them manage at home? And I guess the idea is to help people stay in their own environment, stay in their own home, where they have as much freedom as possible. How does this help people to stay where they are?
Yeah, thanks for that question. So, of course, we've talked about different stages in the progression of the disease. We've talked sort of early on in prevention. We've talked about, sort of mid-stage. Now we're sort of getting to the more advanced cases. And so, as an example, one of the things that is most frightening to family members in more advanced stages of dementia is wandering. And we know that the person with dementia has problems with orientation to time. So they lose track of, is it day, is it night? And they have difficulties with orientation to place. So they don't recognize places necessarily, that even though they've been there for many, many years. So at night, unfortunately, sometimes a person with dementia will get up to go to the bathroom, which is perfectly natural and perfectly fine. But then they'll go, oh, wait a minute, shouldn't I be walking the dog? And then they might go out. And if it's the middle of winter in Ottawa and it's the middle of the night and they forget that they need to wear warm clothes, of course, this can have tragic consequences. So the caregivers often tell us in clinic, look, I sleep with one eye open. Every time the bed moves, I worry about whether my loved one that's living with dementia is going to come back to bed or not. So for that specific case, we have been working on technology, really simple technology, really that's off the shelf. We literally bought it at Home Depot, and we put in sensors, so a bed sensor, motion sensors, smart lights and a smart speaker. And we set up a system that when the person living with dementia gets out of bed, we light up the path right away to the bathroom because, 9 times out of 10, that's what we need to do in the middle of the night. They'll follow the light, go to the bathroom, and hopefully follow the light back to bed. And if they do, the system shuts back down because they're lying in bed and that sensor is turned off. If they go to the bathroom, but then get distracted and then walk to the kitchen on their way out, there's a motion sensor in the kitchen that's connected to the smart speaker. And there on the smart speaker, we've recorded the voice of the care partner saying, honey or dad, it's the middle of the night, please come back to bed. And so ideally then they'll listen to that voice and go back to bed. And again, that'll turn off the system. And then only if they end up going to the front door and opening the front door, then the full-on alarm goes off. So this way, the person living with dementia can be cued first by light, then by sound. And the person that's the caregiver can sleep through all this because they know the technology is watching what's going on. And they really only need to wake up if the front door is opened. And we've applied this technology in a number of homes across the city in Ottawa, and we're now trialing it in settings where there's multiple people with dementia living in the same place. So absolutely, there is a role for quality of life in later stages of dementia.
So do you foresee this technology being accessible to most elderly people living with early stages of dementia in the future?
Yeah, so I mean, I think that everyone's dementia journey is sort of unique, and it's not everyone that's going to need a monitoring system for wandering. But what we're hoping is that by partnering with the private sector, and we have a number of partners already that we're working with, a local startup here in Ottawa, and a large national chain that we're working with as well, looking to make the technology available. Now, having said that, once it's available in the store, does that mean it's available for everyone? And unfortunately, we know that from a financial point of view, not everyone is sort of equally able to afford this technology. So it's really important that once this type of technology is validated, that we look at making sure that the people that can't afford it directly, that somehow we incorporate it into, for instance, home care or that kind of system where home care can provide so many hours a day, but they could also provide some kind of technology as part of their suite of products available.
Okay, we just got a follow-up comment on that from Paula. The new video baby monitors also work well for this. So there's a suggestion as well.
Yeah, so I've actually had a number of patients and families experiment with the currently available technology, home monitoring technology. So, one simple one that people have purchased is either Google Home or Amazon Alexa systems. And, what's really nice is that you just have to say, Alexa, call my daughter, and you don't have to worry about remembering any phone numbers or anything like that. The connection is immediately made. However, even technology that seems relatively simple like that, unfortunately for people with dementia, they will forget the initiation word, right? The initializing word. So Alexa or Google or Siri or whatever Siri. That person, yeah, exactly. Hey Siri, right? So, so what actually some really clever families of patients of mine have done is they've taken this Alexa system, but then they added the nanny cam system, and they would watch to see when their loved one was sitting in the living room where the Alexa system was set up. When they saw them there, they would speak through the speaker that's on the nanny cam, and they themselves would initiate and say, Alexa, call Susan, which is themselves, right? And then Alexa would then call them, their system, and that this way they could have a video chat with their loved ones. So creative ways certainly of using technology that's already available.
If I could just quickly build on Frank's point, I think, Frank, I think you raised a really important aspect of dementia that, sometimes maybe people don't think about, is that the disease itself doesn't just affect the patient. It really affects the entire family. So you think about all this technology and why people might need home care or long-term care as their disease progresses is because of these activities that they, to enable the person to live at home, over time, they diminish in their capacity to carry out these activities, need more and more support. And so, one thing that people, especially in light of COVID, people often ask, well, what do we see, what's the role for long-term care? Do we see people wanting or needing long-term care in the future? And I think the challenge is that because we need patients with dementia need so much support in the community, we need to come up with creative ways. If they want to remain at home longer, I think sometimes we do have to look at these technological solutions to see how we can support not only the patient, but also their family members. And I think that's one area that definitely needs more research in terms of how dementia affects families and family life, and just like the social support and social network for the patient as well.
Right. Thank you. So we have another question here from Safa. Can you tell us the role of the detection of early stages of dementia using OCT or Octa scans? I think Dr. Noffel, that one's for you.
So that's a great question. I mean, there's so many high tech new ways of doing things, and so the idea that the eye as a source of information about what's going on in the brain, I think is an excellent one. And there's a lot of different types of scanning techniques that are looking at the retina. And so we can look at the retina to look at blood flow, because in fact, the back of the retina is actually the beginning of the brain, if you like. So looking in through the eye, we get a view sort of directly on the brain. There's been work on, other than circulation, we're also looking at other kinds of changes that might be happening in the neurons, and seeing if there's anything that can be detected. But certainly the number of high-tech scans for plaques and scans for tangles, these are all very interesting technologies for diagnosis. Having said that, there's always the caveat that this technology does cost money. And so if we want to do a SPECT scan, an amyloid SPECT scan, that costs several $1,000s on everyone that has cognitive challenges, we just have to recognize the amount that will cost the healthcare system, and then consider where else that money would come from. So what would we try to reduce to pay for these expensive new tests? So, and one of the advantages of EEG is that, for instance, it costs about $55 to run an EEG test, as compared to, several $1,000s for advanced imaging. So just to keep that in mind, but it's an excellent question.
All right. And I think the next question is for Dr. Shu, and it's about what kind of diet can help dementia. So there have been a lot of population studies, like the Mediterranean diet, and a little bit of red wine is better than no wine at all. So Dr. Shu, did you want to elaborate on that?
Yeah, you're right, Ruth. There's been tons of research around the association between diets and health in general, right? Of course, dementia. And I think a lot of us have heard about her recommendations for the Mediterranean diet. And I think the research that we've done, and I would be interested in Frank's input on this as well, because I know he often advises his patients on diet. But in the research that we've looked at and we've done, often it's about a balanced diet, right? I think you want to moderate your intake of, for example, red meats. You want to increase your consumption of omega fatty acids. You want to make sure you have lots of vegetables, a good balance of fruits. So when you make a recommendation that fruits and vegetables are good, you don't want people to be eating, 20 oranges a day. I think a lot of it's just about balancing your diet to make sure you have lots of healthy, nutritious foods. And of course, I think Frank's, point earlier about minimizing and reducing certain behaviors. There are things that we know for sure are not good for you. So sugary drinks, fast food, fried foods, we know all those things are not great. But definitely, I think it's more about balancing your diet, rather than focusing on a specific type of food or a specific diet.
But what about some of those key ingredients in, let's say, red wine or blueberries? Are there certain vitamins that are better?
Yeah, there's research definitely around the role of antioxidants, right, in your diet, especially in some of these foods that are great to know. And I think if you have a balanced diet, naturally you will get a lot of this from the fruits and the vegetables that you eat. So I tend to stay away from saying, oh, you need to focus on this specific food or food group. But of course, I'm curious about what Frank recommends to his patients.
Yeah. Dr. Noffel, what do you think?
Yeah. So I certainly agree with everything Amy said. I think what we call a Mediterranean diet, more white meat rather than red meat, lots of vegetables, and the fruit, the small fruit. And the way I think what I try to explain fruit is, the bigger the fruit, the more sugar is in there, and the worse it's going to end up being. The smaller the fruit, the more concentrated all those minerals and good things are going to be in there, and the less sugar there is. So small fruit are definitely healthier than big fruit. But I sort of tell people, think of, look at the food you're eating, and then think of that going sort of directly to the brain, right? So if you look at poutine, it's gooey and oozy and right, and it's like it just it doesn't even go down the drain when you try to rinse off your plate, right? So if that's what that's what it's doing to your arteries, right, rather than a carrot, which is clean and sort of so it's kind of, in many ways, it's just common sense once you think about it, what looks healthier, and then go with that.
Okay, thanks. And so maybe just to follow up, one more question, because there's a lot of debate on it, and that's the idea that one glass of red wine is good for you. Would you recommend that for your patients? Or is the jury still out on that? The epidemiological studies that one glass of wine is better than none at all? What do you think?
Amy, do you want to start with the meta-analyses?
Sure. I think that, there was this really large study that was done a couple of years ago that basically suggests there's no true health benefits that are associated with alcohol consumption. I think a lot of the difficulty with studying the independent effect of alcohol is that it's confounded by other things that we do. So often people who consume wine, for example, they tend to have higher socioeconomic status. I think the people who consume certain types of alcohol, there might be other, I guess, like social behavioral factors that are associated with that. But when you sort of strip everything else away, just look at alcohol itself, the meta-analysis does suggest that there's no indication of sort of health benefit associated, and definitely not a quantity. But I do know that there's some evidence that suggests there's some antioxidant properties that are associated with red wine, for example. But you can also get your antioxidants from fruits, and just go to the grapes. rather than the alcohol. So, I mean, I'm not a clinician, so I don't advise, I don't make these advice to patients, but personally, I think we drink alcohol socially. I wouldn't drink it for health reasons per se. And I don't think there's strong evidence suggesting that, you know, you need to consume or you should consume alcohol to reduce your risk for dementia.
Okay, thanks. Dr. Noffel?
Yeah, I would concur. I mean, I don't think there's any harm in having, you know, a glass of wine on the weekend with family. Regular consumption every day, I don't think is a good idea, and certainly more than that is not good. Certainly once you have cognitive impairment, and you know, the way I'd say it is, look, the brain is already fragile. It's already, you know, starting to have problems. Then why pour more, you know, oil on the fire kind of thing, and by adding alcohol to the mix? That doesn't mean you can't go to a wedding and toast the bride, or, you know, but it should be, once you know that your brain is not 100%, there's, you know, it should only be the exceptional drink, is my advice.
Okay, great. Thanks. So now we'll change gears a bit, and maybe we can talk about the healthcare systems, and I'll direct this question to Dr. Shu. What are the gaps that need to be addressed to ensure we have better care and better capacity in our healthcare system?
Now, that's an excellent question, Ruth. I think going back to my earlier point, you know, there's the care for the patient. So with our population level data, we look at healthcare use, and what we see is that from the time of a physician diagnosed dementia, about 50% of these patients will likely require long-term care within 5 years of diagnosis. So that's a really high proportion, but also keeping in mind, individuals who are diagnosed with dementia often in their late 70s and early 80s. So these are the individuals with some limitations and needing support. But you know, one thing that we know the current healthcare system doesn't do an adequate job in providing is allowing people to remain independent at home. You know, Frank alluded to this earlier, that even if they get home care, many patients with dementia require around-the-clock care. They might be wandering at night, and you don't have someone other than a family member there to make sure that the person is not going out in the middle of winter. And I think that's one of the common stories that we hear, right? Just with the existing resources, we don't offer enough support for patients living with dementia in the community. And unfortunately, that means that many of them will end up requiring round-the-clock residential care, whether in a retirement home, assisted living, or a long-term care home. And the other aspect is that we're in this, you know, in our thinking about the healthcare system, we often don't factor the family members into this as well. They suffer from fatigue, they suffer from physical as well as mental exhaustion from caring for the patient, caring for the person with dementia. And there is actually some research that have shown, you know, often you have an older person and their spouse who's also an older adult themselves, their function decline as a result of providing that care. And within 5 to 10 years, they need that care themselves, and they're not getting adequate support. So that's another area that we really need to start thinking about, which is, you know, dementia is not the disease that affects the person. You have to think about this more holistically about the family unit and other people who are supporting, and the types of services and supports that the caregiver might need as well.
Mm-hmm. So what kind of support is out there in the community for the caregivers?
Yeah, there's actually really great day programs here every year. There's tons of day programs that provide respite for the caregiver. You know, even through home care as well, caregivers can request respite services so that they can actually take the day to run their errands and not worry about the patient being at home, and ensuring that, especially in adult day programs, that they're engaged, they're cognitively and socially engaged in an environment with individuals who are trained to provide support and services to people living with cognitive impairment and dementia. And also there are tons of support groups. You know, so locally, I work closely, and I know Frank does as well, with the Dementia Society, who provide tons of community supports, and even, you know, just peer groups for caregivers as well. So they can find mutual support from each other that the current health system doesn't offer to individuals and their families living with dementia.
Dr. Noffel, did you want to, any follow-up comments on that?
Yeah, so I mean, I certainly agree with everything that Amy said. I think that on the technology side, just to get back to that for a second, there is technology that is there to support the caregiver as well. So for instance, one of my colleagues is doing research on activities within the home. And, one way of doing that is to see if it's, if the person with dementia and the caregiver are in the same room or not, right? So, we love to be together, but we also love and need to be apart sometimes. And when the person living with dementia is always following the person, the caregiver around, that becomes suffocating and exhausting. And so there's actually technology to monitor that and to sort of say, yeah, you know what, you need some respite because of the frequency of parallel activity, right? And similarly, there are apps now being developed for caregivers that check in on how are you doing at the end of the day. Look, how was your day? How are you doing? Are you tired? Are you, are you anxious? And that kind of thing. There are validated tools that can be used for this and incorporated. And I think, we need to be very mindful of the health of the caregiver, because if that goes, then we have two patients that require extra care. So completely agree about the importance of the caregiver.
Thanks for that. And we've got some comments from our audience as well, with options for support for the caregiver. So this is really useful. So we don't have too much time left. So maybe just to a few big picture questions. And the first one is, what is your vision and goal for dementia research in the future? So it's just what direction do you think it needs to go? And then maybe we can start with you, Dr. Noffel, and then we'll move to Amy.
Sure. So again, if I sort of take the 10,000-foot view, everyone would like to stay at home for as long as possible. So, my research for the future will continue to be on that smart home technology and how to leverage it. And it's a balance between sort of looking at the technology that's there and making sure it does what it's supposed to do, because the last thing we need is people spending money on things that don't work. And so that's part of it. But the other is, of course, to keep pushing the envelope and going, that's great that Alexa can do this, but can we make her smarter and do this other thing as well to help our older adults? So yeah, from my point of view, we need to keep working on, and that's my goal certainly, is to look at the early diagnostic phase, like what new technologies can we use to get early diagnosis, so we can get early intervention and we can reduce the risk. In the middling stages, what can we do to monitor? And again, I have a 1-hour appointment every 6 months with my person living with dementia and their family. And if I had data of how activities of daily living were actually working at home, that would make the appointment a lot more efficient. And then at the end stages, of course, is to the safety type technology, which is going to hopefully keep expanding and becoming more affordable, and for monitoring the person living with dementia and allowing some peace of mind for the caregiver. So I really see all points along the dementia journey, looking at the technology that can make those more livable and better.
Great, thank you. So Dr. Shu, the last question goes to you.
Yeah, I think
follow up on that.
Yeah, I think with technology, and there's another opportunity for more research. So with technology, we're getting more data. they're not always better data. I think we still need to do research around what this data is telling us. I think one of the fears is that this is epidemiology 101, you're worried about finding spurious correlations, right? So understanding that data is what I'm passionate about, trying to make sense of the data that we're deriving from different sources, from technology, connecting these various data sources to really develop solutions that will personalize care. So we can personalize, disease prevention strategies by developing these calculators. Then someone could develop an app that informs decision-making around that, but also then taking that into the healthcare system. So traditionally within healthcare, technology uptake is very slow. And often by the time the technology is integrated within our healthcare system, it's already about 10 years out of date. So it's my goal to try to facilitate that, do research and try to help with it, increase the uptake of technology within healthcare so we can provide better and personalized care. And then using that data again to understand, to monitor disease, to monitor healthcare quality, to monitor how we're doing as a healthcare system, building a learning healthcare system, and then reintegrating that information, feeding that information back into how we're providing clinical care. So I see lots of opportunity for personalized care using technology and using data in the future.
All right, well, thank you very much. It was a very interesting session, and I'd like to thank everyone for being with us on World Alzheimer's Days, or World Alzheimer Day, and I'd like to thank our sponsor, Assurance Home Care, and also our experts for being with us, and our audience for sending in the questions and the comments. That's very interesting and very helpful. So thanks again. I think we all learned something today, and have a great evening.